early. South Africa records more than 10,000 new cases. If someone were to give you 10,000 Rand right now, how would you feel? Imagine 10,000. That's a lot of people. With over 5,800 women dying annually, and women living with HIV who are up to 6 times more likely to develop cervical cancer, sit at the center of a dual epidemic that demands urgent, targeted policy action. At the same time, over millions of women who missed the HPV vaccination rollout, which only began in 2014, remain exposed and undeserved. So let's unpack this. We are going to be speaking about Zweli Bashman, who has served as the Managing Director of MSD South Africa, leading efforts to strengthen health systems, expand access to innovation, and advocate for policies that close the long-standing gaps in care. Zweli, good morning.
Hello, Ntsako. How are you?
I'm excellent. How are you?
Fantastic. Thank you very much for having me on.
Thank you so much. So, I mean, we've seen the billboards. As I come to work, there's a very big billboard on the N1, yeah, N1 or N3, and it speaks about HPV injections and all of that jazz, right? But I can imagine after seeing a billboard like that, how many women are actually going to, get the vaccination. So let's talk about this. I mean, the campaign is about 12 years old this year, the HPV vaccination rollout. Let's talk about, just our general response to, our health problems and the HPV policies.
I think the campaign or the vaccination program in South Africa has been quite a successful one in the sense that it has been rolled out in the public school environment. Girls between around about the ages of 9 to 10 get vaccinated by representatives of the National Department of Health. I think it can always improve, and certainly this year, last year, there was an improvement where the program was expanded to include private schools, just to ensure that we have a more inclusive environment. I think the bigger question, particularly for the South African context, is what about those that have had no protection pre the introduction of the vaccination program? And particularly those that are at high risk and largely people living with HIV. Because people that are living with HIV have a greater chance of developing cervical cancer. And so it's important that we also look at how do we escalate and expand the reach of the program. And those are the conversations that we're having with the National Department of Health to try and find sustainable means of doing that. The next layer and the panacea, really, if you look at countries that have achieved elimination, is to do gender neutral vaccination because boys are also transmitters of the HPV virus. And there are also other HPV related cancers, head and neck cancers, anal cancers, etc., that can also be eliminated through broad vaccination rollout.
I'm glad you brought this up. I didn't want it to be a boys versus girls conversation, right? But I think it kind of brings to light perhaps a conversation we're not having enough, and that's sexual education, right? When we engage in unprotected coitus, what are we doing? What are we exposing ourselves to? Does this just exist within the female organs, or are men possible carriers? What don't we know about cervical cancer and potentially HPV as well? Because I know that it's part of, one of the leading causes of cervical cancer. So what don't we know? And I think maybe the education around it will also kind of help with, possibly protecting ourselves through vaccination.
I think the most important thing to note, and it's an excellent question that you raise, it's a debate you can imagine that or discussion that I often get pulled into at family braais or interactions with friends. The most critical thing to note is everyone, probably upward of 90% of people will encounter the HPV virus.
Wow.
It's not something that you can avoid. Largely, your body's own immune system will do what it does, and you will clear the virus fairly quickly. But there is, unfortunately, a percentage of people where that doesn't happen for a number of reasons. And those viral infections will transition into some pathological outcome. The one that is spoken about the most would be cervical cancer,
Mm,
purely because of the statistics that you raised earlier.
mm,
But there are other cancers that HPV does cause. And those, as I mentioned, would be cancers such as anal cancers, head and neck cancers as well, critically important. And so it's important that once you do have the opportunity to vaccinate, is to take that conversation, as you said, away from it simply being something that is done for girls at around the
mm.
ages of 9 to 14, but rather saying vaccination should happen across the entire family. And it really is age and gender agnostic. I personally have been vaccinated. This year, my daughter turns 9 years old. My
Mm.
son is 11. So this year, I will also be taking them for their vaccinations because I think as a parent, um, I would be devastated if years down the line, my daughter develops cervical cancer or my son develops an HPV related cancer.
Mm.
And then I find out that I could have prevented it. Um, and also, I think, a lot of the times this conversation about HPV vaccination is sexualized. But really, if you understand the stats and the statistics that you will encounter it. There's nothing you can do about it. You really then start to learn that this is a critical tool to save lives,
Mm.
a critical tool to declutter the healthcare ecosystem, and a critical tool that could completely change the trajectory of a country purely by acting early in a non-invasive way.
And I'm glad you've taken a very progressive act regarding the HPV vaccination, because I think with us we're very reactive people. I kind of saw it this week when we had that scholar transport accident, and all of a sudden now
Mhm.
the cops are checking for the permits and all of that. So we tend to be quite reactive in the way that we respond to crises. But I think my biggest question now is accessibility. Are we making it accessible? Is this something that anyone can access? Is this something that comes at a cost? Is that something that we have kind of addressed? Is the HPV vaccination free? Do they offer these in the clinics? Because I feel that when we go into the likes of our rural areas, and the reason why also I'm emphasizing on the sexual part of the education is because, that part as well requires a lot of attention, and it kind of leads to that because there are certain STDs as well that people can, get through sexually, sexually transmitted diseases, which cause and could lead to cervical cancer. And
Mhm.
hence I brought it up in this context. But,
Mhm.
is this an accessible vaccination? Is this something that, if someone in the township or rural area wants to go to the clinic and say they want to be vaccinated, what are some of the cost implications that we have placed on this rollout?
So the primary rollout that's executed by the state, focusing on girls between the ages of 9 to 14, is completely free. So the healthcare workers would go to the schools. I believe there's usually a consent letter that is circulated to parents prior, and then the healthcare workers would get to the school and execute the vaccination for those that have been provided with the requisite consent. If you look at age cohorts beyond that, so girls that are older than 14, young women that may be HIV positive, or
Hmm.
generally just young women that have not had the opportunity to get vaccinated before, as well as young men or men. Unfortunately, within the state environment, there currently isn't a subsidized opportunity for
Hmm.
vaccination. The vaccination only does occur in the schooling system. And those are the conversations that we're having with government to say, how can we sustainably expand the vaccination programs to as many people as possible? It certainly wouldn't be available to everyone all at the same time immediately, but we are discussing ways and means of perhaps phasing it and focusing on high-risk population groups, then extending beyond that. One does have to take into consideration the budgetary considerations that are aligned with that. For those people that do have, medical aid facilities, they can go to any pharmacy, a Dis-Chem Clicks or any other pharmacy that they prefer, and they could get vaccinated at the clinic. You don't need a prescription within those pharmacies. You just walk in, request an HPV vaccination. One of the sisters that work in those centers would then discuss with you the different options that you have at play and vaccinate you with the most appropriate vaccine based on the discussions that you would have had. And so there is that sort of, let's call it a two-pronged approach, expanding the public program, the current cohort core program operating very well. And I think if there's one thing that one would want to leave this discussion with is to really emphasize that when parents do get those permission slips, it's not something that they disregard. They really need to read through it, try and do some research or ask questions where they have unanswered questions, and really avail the power of protection through vaccination for their children. And those that have medical aid, as I said, you can walk into the pharmacy with your entire family and get them, vaccinated within the private pharmacy environment.
And speaking of avail, are we having any supply issues, or is everything in order? Specifically in that regard, is the Department of Health ensuring that if there were 100 girls that wanted to vaccinate today at one specific clinic, we're not going to send them pillar to post, because we also need to make sure that the logistics of the vaccination also kind of supports the need for it and the urgency for it.
I can speak on it on two planes. The first one is the school program that is currently running. There certainly haven't been any supply issues that I've been made aware of. Obviously, because the numbers are quite contained, it's quite easy to do projections around demand and utilization based on the number of girls that are in schools and the scheduling that happens around the campaign rollout. So certainly I have never heard of an instance where a child that wanted to or needed to be vaccinated has not been vaccinated in that space. In the broader global landscape, if you asked me this question about 4 years ago, I would have said that there certainly are supply challenges. Because that was the period where vaccination programs across the globe were ramping up. But certainly we've invested upward of $2 billion in our manufacturing capacity. We supply globally, I think, per annum over 800 million doses of the HPV vaccine to over 150 countries. More than 50% of that goes to low middle income countries. On the continent specifically, we have vaccination programs across 30 different countries, and we supply approximately between 20 and 22 million doses per annum, specifically to African countries. We've escalated incredibly. When I took over the business in 2021, we were vaccinating an average of about 7 million girls per annum across the African continent. As things stand now, we are vaccinating about 17 million girls per annum. And so really that tells you how we've ramped up this program. We've recently introduced major countries into this program. We launched a program in Nigeria about 2 years ago. Last year, we launched Ghana. We're looking forward to engaging with the stakeholders, and getting DRC up and running. Because DRC doesn't have a vaccination program. And so supply certainly is not something that one is concerned about at this moment. In fact, we have excess capacity to be able to supply any additional need.
I'm really glad to hear that. I think sometimes we treat the health sector similar to retail, that here's this new product and everyone's just going to come swarming in. And it's really not the case. A lot of people need, a lot of convincing regarding their health, especially the likes of vaccination. So in a continent where we're also a little bit dependent on natural remedies, I'm really proud that we're doing those kind of numbers. Where can we find you guys? Where can we find more information about this, and certainly January being Cervical Cancer Awareness Month?
I think anyone that looks at our social media platforms, so MSD South Africa, we do a lot of education, HPV education on those platforms, and there will be links that lead you to the HPV awareness website, and people really can get a lot of information there. They can also look at our website, msd.co.za. And on that website, we will have dedicated information around HPV, and it will also lead you to the HPV awareness platform that we have built. We're also investing largely in consumer-facing education, completely brand agnostic, but really zooming into disease awareness so that people are aware of it. And similarly, as you said, driving down the N1, you saw a billboard. It probably to you looked out of place, but certainly we are hoping that it's something that would be able to spark some interest. And if you are encountering your healthcare practitioner, it's a question that you would raise, or you'd go down a rabbit hole on a social media perspective, just trying to gather a little bit more information for yourself. We are also working with various influencers that will really just, and particularly the healthcare or doctor influencers that can also share this information on their social media platforms, really direct people to the right platforms. But I would say to people, the most impactful sort of source of information is your healthcare practitioner. And I would encourage people, when you are visiting your doctor, or just, if you're walking past a pharmacy, take a few minutes, walk in, speak to the clinic sister that is available. We've made sure that we've also provided them with educational material that they'd be able to disseminate to people that ask the question. I think for me, just to relay a really pleasing story, was, the height for me was when I was visiting a pharmacy I was in KZN, visiting customers, and I walked into a pharmacy, and there was an entire family, mother, father, and two daughters, that had encountered the information somewhere around HPV and the power of prevention through vaccination, and decided to walk into a pharmacy and ask the requisite question to the sister. And all of them left having been vaccinated.
Wow.
And I think that is the kind of thing that warms my heart, because I'm very conscious of the impact that will have. Maybe not now, but in 10 years down the line, it certainly will have an impact on society and the family clusters.
Prevention is always better than cure. Zweli, thank you so much for joining us today, and definitely we'll be following MSD for more information, and the better, if there's any way we can protect ourselves, I think it's important that we follow through with that. So I really do appreciate your time today.
Thank you very much. Really do appreciate being invited on here.
Amazing stuff. It is a 7:43 Central African time. That was the Managing Director of MSD South Africa, Zweli Bashman. We're talking about Cervical Cancer Awareness Month and the HPV vaccination. And it's so important for us to be mindful of ways we can support our health journeys. And if it means just, preventing, certain things by getting that vaccination, just get it. It is 7:44 Central African time right here on the Oasis.
Got something to say? Are you passionate about issues that matter?
Do you have a voice that deserves to be heard?
Well, we've got the perfect platform for you. Call in or drop us a WhatsApp on +27 63 406 9126.
And we will call you back.
So you could have your say and be part of the conversation.
30 years of age. I just turned 30 on the 15th of November. So that's who I am,
It's not just talk, it's your chance to air your views.
Share your opinion.
Engage with a community that values your perspective.
Follow us on our social media.
Visit our website at www.channelafrica.co.za
And get ready to share your views.
on Channel Africa.
The African Perspective.
This is the Oasis on Channel Africa.
With Ntsako Mhlanga.